Hello, today we are going to demonstrate the reconstitution of medication, retrieving medication from an ampule, Ztrack method, intradermal and intramuscular injections. We will begin by performing hand hygiene. We have already checked the MAR for the right client, right medication, right dose, right route, and right time. We've performed hand hygiene and now we have donned our gloves. Two vials and our syringe. We will start by taking out the syringe, and we have our blunt needle. Blunt needles are used for retrieving medications from vials. It goes through the rubber stopper at the top of the vial. We will use aseptic technique when opening the blunt needle. We'll begin with the diluent. We will clean the top of the vial for approximately 30 seconds. For video purposes, we have shortened the amount of time to clean the top of the vial. We'll pull air back into the syringe, the amount of air that is needed for medication. We will then insert the air into the vial, allowing gravity to work its way. We will then use the aseptic technique to place the top back onto the blunt needle. Then we will have our powdered medication. At this point, I'm flicking it to make sure that all the medication is rolled at the bottom. I'm then going to clean the top of the vial for approximately 30 seconds. Remember, never shake the vial. Never shake the vial at all. You don't want to shake it. You just want to put it in between your hands and roll it. And you want to make sure that it's rolled until all the medication, all of the powdered medication is dissolved and that it is clear. We will then clean the top of the vial once again before inserting the blunt needle. Now we'll pull back the air to draw up the amount of medication needed. At this point, we're making sure that the blunt needle goes into the sharps container and that there are no air bubbles in the syringe. We have our skin here. And we're going to clean from the innermost part into the outermost part. We'll allow the skin to dry, and then we will prime our needle. So when we prime it, we want to see just a little drop at the top of the bevel of the needle. At this point, The skin is dry. Now we're going to pinch the skin just a little, not too much, and insert at a 90-degree angle. Inject the medication and never recap the needle, but do activate the safety on the needle. And then we're going to, we can gently massage this just a little. Now, for the Ztrack method, what we would do is we would hold the skin back, exposing the muscle just a little bit, hold the skin back and insert the needle at a 90-degree angle into the skin, and that is Ztrack method. Now, as for our Ampule medication, what we're going to do is we're going to make sure that we clean the Ampule, and also that we make sure that all the medication is pulled down from the top of the Ampule. So we don't want to leave anything in the tip of the Ampule. I'm going to then get my new syringe to withdraw the medication, and then I have my filter needle, which is a green capped needle, and this needle is used for ampules to prevent any glass from going into the needle. Now we can clean the ampule once again, and we're cleaning this ampule for about 30 seconds, assuring that we've cleaned the neck of the ampule. Okay, now we're going to hold it at the neck with our thumb, and we're going to break this away from us and below and away. There we go. And so now we have broken that. We will place the ampule into the sharps container, and we're going to use our filter needle, and we're going to withdraw this medication. Okay, and then we will go ahead and recap this using the aseptic technique, and then we will make sure that there is no bubbles in there, and we can put on our new needle using aseptic technique. We will then prime the needle and prepare it for the injection. We can label this if we're not at the client's bedside, and prime. Now, as for the tuberculosis as for the intradermal, what we want to make sure that we do is we have the right needle size, because this is going to be an intradermal injection, and this is going to be right underneath that first layer of skin. So we have the right needle, we have our medication, and we have our patient. What we want to do is we want to make sure of that, and then what we would do is inject the amount of air needed into the syringe, withdraw our medication, once that is withdrawn, then we have primed it, making sure there are no air bubbles, and we are going to clean the skin from the innermost to the outermost area. Okay, and here we go. I'm going to hold the skin taut, right? And we're going to hold the bevel up. So the bevel is up and we are going underneath the skin. And then we can inject the medication till we see our bleb. And document this information, perform hand hygiene, and then that will be it. If we needed to, leave the patient at the lowest position and leave their call light within reach. And that will be all for this video. Thank you.